For President Biden, the surprise of this first trip to Asia is not the work to build diplomatic alliances and economic ties. The unexpected is that another health threat, growing cases of monkeypox, demands his attention.
It is something that everybody should be concerned about. We're working on it hard to figure out what we do and what vaccine, if any, may be available for.
The World Health Organization says monkeypox has been found in at least 12 countries, including the U.S., with confirmed cases in New York and Massachusetts. A possible third is being investigated in Florida. No deaths have been reported.
Monkeypox. Okay, so this is the latest thing that's happening. As you saw, President Biden's over there overseas. He was on the tarmac talking about how people should be paying attention to it. Maybe it's a little bit hard to hear, but he did mention we're gonna look maybe to see some issues as far as vaccines. Oh my God, so this is of course happening overseas, but there are 3 states in America that have already seen a case or two, very low level amounts here. But we have to, as you can imagine, Biden's probably trying to get ahead of this so it won't look the same way it did as something like COVID started and the Trump administration wasn't really all over it. So he probably wants to change things. So let's look at some of the details of monkeypox and exactly how worried or even like aware, maybe is a better word, people should be. So monkeypox is this virus that can cause symptoms including fever, aches, and presents a distinctive bumpy rash. It's related to smallpox, but it's usually milder, particularly in the West African strain of the virus that was identified in a US case, which has a fatality rate of around 1%. Most people fully recover in 2 to 4 weeks, is what this official said about it. Now, the virus is not as easily transmitted as the SARS-CoV-2 virus that spurred the global COVID-19 pandemic, of course. Experts believe that the current monkeypox outbreak is spread through close, intimate skin-on-skin contact with someone who has an active rash. That should make it spread easier to contain once infections are identified. So as of Friday, some 80 monkeypox cases have been confirmed and an additional 50 are under investigation in 11 countries, that's according to the World Health Organization. And also recent outbreaks reported so far are atypical. That's of course, according to the WHO again, as they're occurring in countries where the virus does not regularly circulate. Scientists are seeking to understand the origin of the current cases and whether anything about the virus has changed. So before, actually let's look at an image of a case of this. I don't know if you guys like seeing skin issues and abrasions here, but that is a particular case. I've seen other pictures where the issues on the skin are larger. They look more bubbled type of issues with the skin. So I think it's, again, the comparisons when it comes to things, Jackson, things like COVID and the pandemic and coronavirus, I think are a little bit different because as people point out here, it's skin on skin contact versus an airborne breathable virus that's similar to like the cold or the flu that you can catch through those type of things. So maybe we can see this and contain it more because who's really rubbing up on someone else who they've seen these types of abrasions on their skin? What are your thoughts here, man?
Well, I think my thoughts are, first and foremost, luckily COVID was not as dangerous as something like Ebola. Because I think that this is a good example of how we have to always have our people at the front lines ready. Because one of the biggest reasons the United States has such a terrible response to COVID is because the Trump administration dismantled and defunded many of the institutions that would have helped us fight against this better. So again, it's easy to look at something like this and say, well, it doesn't have a high infection rate, well, a high mortality rate rather. And it seems to be, kind of more like behave more like a sexually transmitted disease does. However, again, I think that the fact that, COVID-19, on paper has a very low death rate as well. And yet look at how many people suffered and died from it. So I think that again, what's important is that we're always prepared and that we should always be ready, even if we think that it's not a big deal, because it could end up being one.
It's weird because it's almost like I don't know if I can go back as far enough to know the direct and quick response from administrations or just health organizations about previous issues that happened, because maybe we're back in the normalcy of, hey, you guys, this is something that we're seeing and we're seeing the cases and spread happen in other places. So be aware so that we can maintain and maybe suppress it. The world kind of changed with COVID because after the Trump administration ignored it, downplayed it, and then tried to hide it from folks until they just couldn't hide it anymore. then became the vaccine talk, and then became the distrust in what the government will tell you about these types of cases, from origin to how it spread to the how lethal it is, all those types of things. So I wonder when the next, I thought this to myself before, I said when the next thing happens, because there's always been things, COVID wasn't the first thing. When the next thing happens, how much will we trust what we're being told about what we should do to prevent it, and also its prevalence? So really fast about this vaccine. The UK has begun to inoculate healthcare workers who may be at risk while caring for patients with smallpox vaccine, which can also protect against monkeypox. The US government says it has enough smallpox vaccine stored in its strategic national stockpile to vaccinate the entire United States population if that's necessary. I don't think anyone's gonna be on these types of things ever again, no matter what it is. And as is pointed out there, smallpox vaccine is the one that can be used for this. So even if that gets presented to folks, we'll see what the political ramifications and political arguments are, and if it's an election year. Let's keep it real, that's gonna be the basis for this.